Honey, I called you 10 minutes ago. You gonna come in for dinner? Honey, what's wrong? Honey, lift both your arms for me. I don't like this. I'm gonna call 911. Hi, I think my husband has had a stroke. He's in the garage and he's kind of limp and his right arm is hanging down pretty loose and he's mumbling. He's making words that really don't make any sense. Could you send somebody?
Acute neurological injury can result from trauma, stroke, or decompression illness. In this section, we will cover stroke and introduce the FAST exam as a way of quickly assessing for neurological injury. Neurological injury requires rapid action. As soon as you think a victim may have suffered neurological injury, activate emergency medical services. The signs of stroke include facial droop, inability to raise or move an arm, and slurred, garbled, or nonsensical speech. The FAST exam utilizes these common signs to enable rapid assessment of neurological injury. Start with an evaluation of facial muscles by asking the person to smile, looking for any signs of facial weakness or droop. Evaluate arm strength by having the person raise their arms and bend their wrists. Ask them to hold this position for approximately 10 seconds.
Great.
Evaluate speech through simple conversation. If any of these appear abnormal or are new deficits, activate emergency medical services. The faster acute injury is detected and emergency services alerted, the greater the chances that medical treatment will reduce injury and disability. Signs of neurological injury may indicate stroke. As the third leading cause of death and the leading cause of long-term disability, quick recognition and rapid activation of emergency services provides the best chance of reducing the extent of injury. To help you remember key signs, use the mnemonic FAST. Facial droop, arm weakness, speech, time. Note the time and telephone for help.
Honey, I don't want you to worry. I've called 911. They're going to be here shortly.
Once EMS is activated, complete the full DAN Neurological Assessment. Your findings will help medical personnel determine injury progression and create a clinical baseline from which future changes can be compared.
I want you to push against my hand.
In the case of severe neurological injury, assessment of certain vocal or motor responses may not be possible.
Now push down.
If the injured person is unable to speak or move a particular limb, note the deficit and proceed to the next part of the examination. In the case of garbled, slurred, or nonsense speech, the medical history and mental function portions of the examination are deferred. Focus on what you can assess and pass your findings on to medical personnel.
Push out against my hand.